Hello, welcome to prenatal class hosted by MHC Pediatric Department. I'm Dr. Tanase, one of the pediatricians. Dr. Sternstein and I will be your guides on the journey of parenting a new life on this planet. If you're listening to this lecture, you're either waiting for a baby soon, planning to have a baby, or you're already a parent. Want to congratulate you first for bringing a new life on earth and for embarking on this difficult but rewarding task of parenting. Whatever stage in life you are at this moment, this presentation will walk you through baby development during pregnancy, importance of maternal health, what happens at the hospital for an uncomplicated hospital stay, what to expect after bringing the baby home, routine doctor visits, vaccine schedule, common problems in infancy, and how to choose a doctor for your baby. So let's get started. This slide shows a picture of the fetus development during the intrauterine life. It is not meant to scare you, but to show you how long and what different parts of the body are formed. The blue lines represent times when major abnormalities could happen, and the green bars represent minor defects in the rare case an insult would occur. As you can see, the brain takes the longest to develop, and the process will continue after birth until close to 2 years of age for the anatomy and size. Brain function will take the next 18 to 21 years to develop. What that means is that we need to pay close attention to maternal, physical, and mental health during pregnancy, the physical environment, and try to avoid as much as possible exposure to smoke, toxin, and chemicals. Maternal social environment, the amount of support is also important, as well as prenatal visit to your doctor. So what can you do to create the best conditions for this new life? The next two slides will focus on nutrition. From ancient time, people knew that food is medicine, is nourishing for your body and for the baby's body. The Mediterranean diet is the best studied way of eating for everyone without medical problems, as well as for people with inflammatory illness or cardiovascular problems. It focuses on whole foods, includes fruits, vegetables, legumes, dairy, eggs, whole grain, lean meat, fish, and seafood. It limits sugar, red meat, and of course processed foods. Avoiding sugar could be challenging, and the other sweeteners on the market are not better either. Could enjoy honey, dried fruits, figs, or dates. If possible, focus on organic foods in order to limit pesticides. This is a short list. Things to avoid include undercooked meat like hot dogs, lunch meat, meat spreads, partially cooked eggs, as they could carry bacteria. Also avoid unpasteurized milk, soft cheeses made from unpasteurized milk in order to avoid foodborne illness. Wash well fruits and vegetables, avoid uncooked sprouts. Do not eat raw fish or seafood for the same reason. These slides review sources of other toxins that we are commonly exposed to. Some unwanted effects could come from prescription or over-the-counter medicine, so review with your doctor all the medicine you're taking. Other chemicals comes from plastics, so try to avoid plastic bottles and plastic food containers. Choose personal care products like soaps, creams, lotion, cosmetics with natural ingredients. Drink filtered water. Avoid non-stick pans for cooking. And avoid fish high in mercury, like some types of tuna, mackerel, swordfish, or shark. As you are approaching term, here are a few unexpected events. Preterm labors mean having contractions and delivering the baby before 37 weeks. This can happen occasionally depending on maternal and infant health, and some infants will need to spend a few days or week in the neonatal ICU. There they are monitored to make sure they could feed well, grow well, maintain their temperature and sugar level. If the labor is too long, or the baby is not in the right position, or there are signs of distress, your team might decide on a C-section. After birth, the typical hospital stay is 1 to 2 days. This is the time to establish feeding, to monitor the infant for signs of distress, monitors wet diapers and stool. As part of routine newborn care, infants will receive vitamin K injection to prevent bleeding complications, antibiotic eye ointment to prevent infection, and will get a poke in the foot to obtain blood for newborn screening. This is a test required by the state to check for genetic problems and includes a hearing test. Newborns will have the jaundice level measured and will receive a hepatitis B vaccine if you wish. Here are all the normal things an infant will do: feeding, passing urine and stool, crying, sleeping, and repeat. Infants will have at least 1 stool diaper before hospital discharge, at least 2 to 3 wet diapers a day, and will try to feed every 1 to 3 hours and fall asleep while feeding. I want to discuss a little the benefits of breastfeeding over formula, just in case you have doubts. The American Academy of Pediatrics recommends breastfeeding for all infants. There are very few reasons when breastfeeding is not indicated. The first few days, you'll produce the colostrum, which is a thicker milk in small quantity, food of antibodies and nutrients. Breastfeeding transfers your antibodies to the baby, and in this way it helps fight infection and have a strong immune system. Breast milk helps with brain development. Studies comparing babies that breastfed for the first 6 months showed better school performance during school years. Breastfeeding transfers the good bacteria from your body to the infant that helps with digestion. Also, breastfeeding releases hormones in the maternal body that helps the uterus heal faster. It is cheap, ready to use, you always have it with you. Last but not least, breastfeeding creates a bond, a sense of security for the infant, helps with the attachment to the parent, which is just a fancy word for love. Just a few words about Women and Children's Services called WIC. This is a great resource if you qualify. If you meet the income criteria, any woman that is pregnant, breastfeeding, or after birth, and all children after 5 years of age could benefit. There are many WIC offices situated in MHC clinics. We can provide formula to infants, breast pump and lactation support for breastfeeding mothers, provide food for children and mothers, offer vouchers for farmer markets for quality food, and also provide nutrition education. Again, if you qualify, do not hesitate to use WIC services, as you will need all the help you can get. The first few days and weeks after having a baby, there is a big adjustment for both the infant and the whole family. As the baby is settling into a rhythm of feeding, waking up, regulating the night and day cycle, the whole family will be transitioning into a new way of life. If there are siblings in the house, there might be some emotional adjustment and competition for parents' attention. I encourage fathers to have an active role. If the infant is bottle feeding, fathers could take a shift during the night to split responsibilities and let the mother rest. If the baby is breastfeeding, fathers could help with changing diapers, providing food and comfort for the mothers. This might be a difficult time for mothers due to hormonal changes, pain from delivery, lack of sleep, excessive worrying, or low moods. If feeling overwhelmed, please do not hesitate to ask for help from family, friend, or health professional. Try to spend the first few weeks attuning to baby's need. Enjoy these moments, and you can postpone or delegate house cleaning, meeting with friends, or other errands. Some mothers will need to return to work in a few weeks, which makes this initial time even more precious to attend to baby's needs and also to your own needs. There will be doctor visits to help you navigate newborn care and address any concerns you might have. Here is the schedule for routine visits. I am turning the conversation over to Dr. Sternstein. Wish you well, easy pregnancy, delivery, and adjustment to life as a parent, and we're always here to support you.